In this video, we'll discuss about IPSG, International Patient Safety Goal. It having 6 goals. First one is identify patient correctly. We want to identify patient correctly. Second one is improve effective communication. We will give effective communication to patient. Then improve safety of high altered medication, then ensure correct site, correct procedure, correct patient surgery, then reduce the risk of healthcare associated infection and reduce the risk of patient harm resulting from falls. So IPSG, International Patient Safety Goals, it having 6 goals. Identify patient correctly, improve effective communication, improve the safety of high altered medication, ensure correct size, correct procedure, correct patient surgery, then reduce the risk of healthcare associated infection and reduce the risk of patient harm resulting from falls. So, according to IPSG goal, first one is identified patient correctly. How to identify? These vary from hospital to hospital. So, kindly stick on the policies and protocol to the hospital. You are working as a nurse. We can identify that patient full name, then MRN, medical record number, then date of birth. Identify the patient full name, MRN, medical record number and date of birth. Then how to identify unknown patient, but say for example, bus met accident, group of people rushed into the hospital. You may not know the name of that patient. They may not have any proper ID proof or some things. So, in such cases, you can identify the patient as unknown male 1, unknown male 2, or unknown female 1 and unknown female 2, and so on. Unknown patient, how to identify it? Unknown male 1 2, like that. Until you get a proper ID proof, you can recognize or identify the patient as it is mentioned, and again it varies from hospital to hospital. When to identify patient, you have to identify the patient at the time of admission. When to identify it? At the time of admission. When to identify the patient on admission? Before transferring to other unit, then before administering medication, before withdrawing blood sample, before administering blood and blood product. These are the time we identify that patient on admission. Before doing any procedure or before serving diet, restricted diet, that time we want to identify our patient. So on admission, before administering medication, withdraw blood sample, then administering blood and blood product, then before doing any procedure, before serving restricted diet, this time we want to identify our patient. The second one is improve effective communication. We need to keep 3 things in our mind. First one is, most of the time we will be confused with the read back and repeat back policy. So first one is a read back policy, repeat back policy, then handover. What is read back policy? For instance, something goes wrong with your patient and you are informing this to the doctor. So at the moment the doctor is performing a surgery in the operation theater, so he cannot come and prescribe the medicine at the moment. So in such case he preferred to give the telephone order. And the second one is critical lab value, so that is the otherwise known as panic value. So you are sending some blood investigation to the lab, and if the result is lower or higher than the normal range, that is known as panic value. In such case the lab technician may call you and inform. So in this two situation, read back policy is applicable. Telephone order and a critical lab value, read back policy is applicable. So what do whenever you are receiving verbal order through telephone? First steps, you have to write down. First step, we have to write down whatever you are listening through the telephone. Second one, read back. You have to just read back whatever you have written. And the third one is confirmation. So while you are reading back the thing what you have written, the person who sent the message has to confirm whether it is right or wrong. Let's see with an example. First one is the telephone order. First one is the telephone order. So for example, you check the blood sugar for the patient. It is 395 mg per deciliter. The doctor is not around. So you are making a call and informing the doctor for Mr. Johnny MRN 123456. Uh, the blood sugar is 395 mg per deciliter. As the doctor is performing a procedure at the bedside, he cannot come at the moment to write the drugs. So he is giving you a verbal oral through the telephone to give regular insulin 15 unit subcutaneous state. As per the protocol, you have to write down the order first, then just read back. Doctor is that Mr. Johnny MRN 123456 regular insulin 15 unit subcutaneous state. Then you are reading back. The doctor has to listen that and reply back, yes nurse, you are right, you have to give regular insulin 15 unit subcutaneous state. Second one is critical lab value or panic value. So most of the time it will be informed from the lab by the lab technician. So they may inform you for Mr. Johnny MRN 123456, potassium is 2.5 milli equivalent liter. So as per the protocol, just write down whatever you are listening and read back. That is that for Mr. Johnny MRN 123456, potassium is 2.5 milli equivalent per liter. When you are reading back that one, the lab technician has to listen that are replied back, yes nurse, you are right, that is for Mr. Johnny MRN 123456, potassium 2.5 um, milli equivalent per liter. So you all know the documentation. You all know that documentation is very important in nursing. So after receiving the telephonic order, make sure it should be transcribed by the physician within 24 hours. It should be transcribed by the physician within 24 hours. So at that moment, the doctor is busy with some other procedure. That is the reason why he cannot come and write the order. As soon after the emergency finish, the doctor has to transcribe the medication in the medication card, and again this varies from hospital to hospital policy and protocols. Again, this varies from hospital to hospital policy and protocols. The second one is panic value. So the person receive the panic value has to document that with the date, time, critical value, name of the person who informed, and the name of that person who received the call. So all the hospital we have critical value or panic value registered, and the person who received the panic value has to document that the panic value register. Moreover, in all the hospital we have list of drugs approved for verbal order. For instance, the narcotic or the high altered medication order are not agreed through telephone. So you have to go through that policy and make sure what and all drug can be received through the telephonic order. Repeat back policy. So repeat the policy is applicable in case of emergency situation. The best example is cardiac arrest. Here you must follow repeat back policy. Why cannot you follow read back policy here? Because in read back policy you have to write down, then you need to read back that, and it needs to be confirmed by the person who sent the message. If you follow that order in case of cardiac arrest, it will take more time and it will put your patient life is trouble. So here we are following the repeat back policy. So what what you mean by repeat back order? So whatever order is given by your doctor, you have to just repeat back in order to confirm. So here your doctor is telling you to administer injection adrenaline 1. Doctor order to you administer this injection adrenaline 1 mg intravenous state. You have to just repeat it back. Doctor, is it injection adrenaline 1 mg intravenous state? And your doctor has to confirm, yes nurse, you are right, just give injection adrenaline 1 mg uh, IV state. The last one is IS bar. I stand for identification, S stand for situation, B for background, A for assessment, R for recombination, recommendation, A for assessment, R for recommendations. IS bar play a vital role in hand over the process. So in identification, which include patient full name, MRN, date of birth, age and sex. Situation, for example, if the patient got admitted with complaints of multiple episode of vomiting, diarrhea, that will come as a situation. We background. So if the patient is known in case of diabetes mellitus or hypertension, that that can be mentioned in background. Next one is assessment, which include the vital sign of that patient or any significant finding. The last one is recommendation, so here anything to be followed. For example, CBC, total blood count to be sent tomorrow morning, or just x-ray done for the patient, and the flame need to be collected, and so on.